Hello, I am Sandra.
Hi, Sandy.
I'm a student nurse.
Welcome.
Can I get an S-bar report?
Oh, certainly. Okay. I'm taking care of Shanana O'Connor. She's a 34-year-old black female. She came in this morning with fever and chills. Her background is she's had end-stage renal disease due to diabetic neuropathy. She's had this for about a year, but she's had diabetes since she's about 8 years old. She is on dialysis. She had a treatment this morning. She does have histories of UTIs, urinary tract infections. She's activity as tolerated. She's on daily weights with vital signs Q4 hours. The most recent temp was this morning a 101.1. Her pulse is 104, sats are 96, her blood pressure is 136/85. She's allergic to sulfa. When she took Bactrim, she said that I guess it gave her a rash. So, and she's also a full code. We're supposed to notify the doctor for temps over 101. Her blood pressure is over 180/100. If she needs to keep her sats above 92, we can titrate nasal cannula oxygen as needed. For her assessment, her chest expansion is symmetric, all lobes clear to auscultation. S1 and S2 are present, no murmurs. She does have slight 1+ non-pitting edema, both bilateral lower extremities. Her femoral pulses are 2+, 1+ pedal pulses. Her cap refill is less than 4 seconds in her lower extremities, but she also does have diminished sensation bilateral lower extremities. She's on a renal diet with a 1,500 milliliter fluid restriction. She's on INO. Bowel sounds are present, all quadrants. Her labs are pending. She has a AV graft for her dialysis in her left forearm. It is non-tender. And then she has a saline lock in her right forearm median vein. So our plan is to hang a bag of normal saline at 30 mLs an hour, and also the doctor wants to start her on Premaxin, which is an antibiotic. So we're going to hang that too. Okay?
Okay. Is it okay if I ask you a couple of questions?
Oh yes, please.
Okay. Why specifically is this client receiving the medication?
Okay, well, due to her history, the doctor wants to start her on this broad spectrum antibiotic prophylactically, just in case her blood cultures do come up with something positive to treat an infection. It treats gram-negative infections such as pneumonia and urinary tract infections. It's a beta-lactam. It destroys bacteria by destroying the cell wall. And the normal saline is just a maintenance IV. It's only going to run at 30 an hour for fluids.
Okay. What action does this medication have on the body?
Well, it's going to destroy any bacteria.
And what should you question administering this medication?
Well, shouldn't give the medication if she's allergic to drugs in the class of carbamazepines, or patients with a penicillin allergy. And it said we should use caution with renal impairment, but since she's had her dialysis this morning, normally this would be filtered through, sifted out through dialysis, so we want to make sure that her body's going to absorb it, so we're going to administer it after dialysis.
Does the medication have a therapeutic serum level?
This particular one isn't one of the antibiotics that they monitor the peak and trough strictly. The doctor may want to do a random level at some point to make sure she's not toxic.
What vital signs should be monitored?
We're going to monitor her temp, like I said, because we need to notify the doctor if it's over 101. We want to make sure that her temp is low. That's one of the signs that the antibiotic is working, as well as her blood pressure and pulse and respirations.
Which physiological parameters should be monitored when the medication is being administered?
We're going to watch out for any signs of anaphylaxis, any rash, difficulty breathing, swelling of the tongue or face.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
I'm going to instruct her to let us know by putting on her call bell if any of the signs of an allergic reaction appear.
What interventions must be taught for taking the medication safely at home?
Well, this particular antibiotic is only given IV, so it would be in a hospital setting, or possibly, I guess, they could set up a home health nurse to administer it via IV at home, and then at that point it would be the same to watch out for any signs of allergic reaction.
What are the side effects and potential adverse reactions? You kind of mentioned some of them already.
Well, she could get nausea, diarrhea, vomiting, maybe redness at the injection site.
And then how will you know the medication is effective?
We should see a decrease in her temperatures.
Okay, thank you for
You're
answering
welcome.
my questions.
Alrighty. Do you want to follow me to her room?
Yes.
Okay. Knock, knock.
Hello.
Hi, Miss O'Connor. My name's Lisa. I'm your nurse today. I have Sandy. She's a student nurse.
Hello.
Hi, nice to meet y'all.
We're going to give you your, hang a bottle of IV fluid for you and administer one of your antibiotics. The doctor prescribed imipenem and celastistin. It's actually called Promexin. So it's a broad spectrum antibiotic, and we're going to try and treat your infection if you have one, okay? We're going to use it, he wants to use it prophylactically, just in case, okay?
Okay.
Alrighty, so, let me wash my hands. And I'm going to get the computer going here. Can you tell me your name and date of birth?
Yes. Shanae O'Connor, 34 years old.
Okay, and can you tell me again what you're allergic to?
Sulfur.
Okay, that's what we have listed here. I'm going to go ahead and verify it with the MAR. Okay, Shoshana O'Connor, 34-year-old. You're allergic to right here. Drug allergies. Right there. So she gets a RAS if she takes this. Alrighty, so I'm going to go back over to the MAR. And the IV we're going to hang right here is 0.9% normal saline, which is also known as sodium chloride. And we're going to hang it to run at 30 mLs an hour. And I'm going to hover over this so we can see that. Here's the antibiotic, but we're going to do this normal saline first.
does the pharmacy go ahead and mix it, or do we have to mix it, or how does that
And
work?
it comes up from the pharmacy, and the pharmacy double checks, and I've already checked in my book about the Promexin, this imipenem silacin, to make sure that they're both compatible. And actually, it would show me exactly what the rate is right here. But once I click over here, after I scan her and all that, it should work. So what I'm going to do is I'm going to, let's see, let me get my fluids ready.
Mhm.
All right. Right now we're going to be working on the sodium chloride, which is normal saline. It's not expired. The fluid looks good. It's clear. 10, 10, 20, so we're good there. Here's my maintenance IV. This is a little dial-a-flow. So I'm going to make sure everything's locked. It says off right there. I'm going to switch it over to off. I'm going to clamp the lines for safety. It's clamped. I'm going to take this off. Everything is sterile here, so I want to try and make sure. Once I take the tops off, unravel it. I'm going to start with this.
So that bag there, what was that again? What drug was that?
This is normal saline, so I'm going to go check it with the MAR, which is sodium chloride right there.
Okay. Thank you so much for showing me.
All right, so this is sterile right now
Mhm.
because it's covered with the sheath, so I'm going to take the sheath off.
Mhm. Yep.
And then I'm not going to touch anything because it's sterile. I'm going to take this out right here.
Mhm.
And I'm going to screw it in there. And now I'm going to prime my tubing.
Okay.
Okay. I connect this dial-a-flow down here. All right. So, can I get over here to a little trash can or something?
Mhm.
Making sure. I'm going to slowly let it out.
Mhm.
Actually, what I can do right now is just go ahead and hang it right here. So since this dial-a-flow is off, I'm just going to put it on just a little bit so we can get some fluids out here.
Mhm.
Squeezing that a little bit to get some fluid going. And the bubbles out. It's coming out now. tubing is primed. I'm going to go ahead and enter her name in here for the sodium chloride and her, let's see, I have my information over here. We're going to plug her numbers in. 842-334-3660. Okay, so now we're going to do the medication, which is, do you mind walking over there and reading it to me, Sandy? D.
9 B
Yes.
902 98 68 399 D.
D. Okay, see, we see the green one. So the site right here is her right forearm. So I'm going to do right forearm. And the time is 8 o'clock. Okay, so IV, normal saline. The injection site is non-tender, and what I'm going to do is go ahead and flush it. I'm going to draw back and make sure that the vein's going. Okay, scrub the hub. Seconds. Okay. Okay, do it a little, draw back. I saw blood, so I'm going to go ahead and flush it. Since I've already scrubbed the hub, I'm going to connect this. I'm going to switch it to 30 right here before I unclamp it. At 30. I'm going to go over here and unclamp. Then I'm going to wait for 5 drops. All right, we're good. Okay, so now I'm going to go over here and save this, and now we're going to hang the piggyback. Now let me put my initials in first. L-A-L. I'll say hung, flushed, and patent. Dialaflow at 30 mLs an hour. All right, so save that. Now I'm going to go ahead. Okay, so I guess I'm going to correct my little time here. Okay. Well, actually, it's 19. All right, so now I'm going to go ahead and look at this IV piggyback, which I'm going to check to make sure it's clear. Expiration, whoops, Good thing we have backup normal ceilings. Okay, this is matches. Imipenem, Cilastatin, Primaxin. It's clear, 500 milligrams and 100 mLs. Normal saline expires 8 of 2018. Alrighty, so again, she's allergic to sulfa. Can you tell me your name and date of birth again, please?
Sinead O'Connor, 34 years old.
And what are you allergic to?
Sulfa.
Okay, thank you. Alrighty, so.
You want me to read the number?
Oh, sure.
Ready?
Yep.
8423343660.
Okay, now the medication. Go ahead. Thanks.
D
Yep.
90
Mm-hmm.
E
Yes.
9
Yes.
F
Yes.
3519 C 249.
Okay, so we're all good there. All greens.
Mm-hmm.
And it's 7:45 in the morning. Alrighty, we're going to hang it as a piggyback to the normal saline. We've already checked the drug manual and they're compatible.
Okay.
Alrighty, so what I'm going to do is I'm going to use this secondary tubing, okay? This is all sterile container. I've unwrapped it. I've made sure locked for safety. I'm going to take this off. This is sterile. I'm going to plug this right in there. Okay, so what I'm going to do is I'm going to go ahead and I'm going to scrub the hub in a second, but I'm going to lower my IV. And then I'm going to do a backwash with this in this port. Here. I'm going to go ahead and stop this real quick while we're doing all this, just for safety. This one, scrub. Right here. Okay, now I'm going to unlock this and let it backflow till it starts to come up, and it's come up, see, halfway.
Okay.
Alrighty, all my safety locks are on. So I'm going to hang this up here. Make sure it's higher than the normal ceiling. And I'm going to right forearm, piggyback, hung. Now it's going to go at 100 mLs an hour because the bag is 500 milligrams and 100, and he wants it to run over an hour. So I'm going to go over here and change the dial of flow to 100. And then I'm going to have to set my personal computer alarm here to make sure that I come back in about 50 minutes to check on the IV and maybe hang out for a little bit so I can switch it over to 30 mLs, which is what the maintenance line is. Okay, so this is at 100 right there. Everything looks good. I'm going to go ahead and unlock. Unlock. I'm going to wait for this to go. And it's going. So I'm going to come over here and put my initials. And piggyback hung. Set alarm to assess in 45 minutes. Okay, does that look good?
What about the dose given?
Okay, yeah. We are going to put 500 milligrams in 100 mLs normal saline at 100 mLs an hour. We good? Everything look good? Alrighty, I'm going to save it. And I'm going to finish my charting out there.
What is this thing?
That is to go on the IV tubing. I'm going to put it for 4 days from now.
What does it do?
It tells us that we have to change it in 4 days.
Oh, okay.
So I'm going to put today's date, my initials, and it's 7:45 a.m. 0700, and today is March 27th. I'm going to put 2 of them on because both of the tubings were brand new. 0745. Alrighty?
I just have a couple of questions to ask. If you
Oh,
don't
okay.
mind.
Yes, please. Go ahead. And wait, real quick, I'm going to, Ms. O'Connor, I'm going to give you some information about your medication that I have given you. It's a little teaching information.
Okay.
It goes over everything I talked to you about earlier when I first came in here. And just let us know if you see any signs of any kind of rash or itching or shortness of, like your tongue swelling or any swelling, okay?
Okay.
There's that. And here's your call bags in your reach. I'm going to lower your bag to the lowest position. It looks like it's already there. And let us know if you need anything else, okay?
Okay, thank you
so
very much.
much. All right.
Thank you.
All right.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Number one, I made sure that she wasn't allergic to the medication, and then it was on her MAR, and the pharmacy dosed it correctly.
Does this information affect your decision to administer the medication?
Yes, I did. I went ahead and did it. You know, but before we leave the room, I'm going to go ahead and take my gloves off and wash my hands. Alrighty. What else? I'm sorry.
Did this information affect how you administered the medication?
Yes, I made sure that it was given the right route, the right dose, the right time, the right patient, and the right med.
Okay. Thank you.
Okay, thank you, Sandy. All right, good luck.